So I've just entered my patient's room. I'm going to wash my hands. So hi, my name is Kelly and I'm your nurse today.
Hi.
So today I'm going to be performing a full comprehensive assessment on you. And your name is Josh?
Yes.
Okay, so I'll make sure I have my right patient. Check his armband. So I'm going to start by having you lie down. So I'm going to first just take a general look at his appearance, check his hygiene. I'm going to first assess his skin, looking for any irregularities, any scars, any wounds, any lesions. Gonna lightly palpate his arms, checking the color of his skin as well. Gonna assess the skin on his legs. Lightly palpate. His skin does look good. I don't see any abnormalities. Next, I'm going to assess his hair, looking at the texture, the distribution. And assess his nails. So I'm going to assess all the nails of his fingers, looking at color, length, noticing any abnormalities. Also going to check his toenails for the same. Okay, I now am going to assess his head and neck. So Josh, if you could sit up for me. Alright, so I'm looking at his head, looking for symmetry, just getting a general view. So I'm now going to palpate his temporal pulses. Those feel good. And palpate his carotid pulses, one at a time. Okay, I'm also going to auscultate. I'm going to auscultate the temporal pulses. And the carotid pulses. Very good. I'm going to palpate his sinuses. Just a little pressure here on your sinuses. Any pain there? Okay. And I will palpate his lymph nodes, starting up by the back of his ears. I'm just going to lightly palpate, feeling for any masses, any enlarged lymph nodes, any pain and tenderness. No? Okay. And go down his neck. Again, feeling for the lymph nodes. Check the clavicle lymph nodes here and the axillary lymph nodes. I then want to palpate for his thyroid. I'm going to do that from behind, so if you can turn your back towards me and just swallow for me. Very good. So I'm feeling for his thyroid there, checking if it's enlarged. It felt good. You can turn back around for me. And then I'm going to have you open and close your jaw. Any pain? Okay, perfect. So next I'm going to move on to inspect his eyes. I'm going to be inspecting his upper and lower eyelids. That looks good. I'm going to do a few vision tests. Is that okay?
Mm-hmm.
All right, so I just want you to follow my finger with your eyes. Perfect. Once more. Okay. And then can you cover one of your eyes with your hand? And just stare straight ahead and tell me when you see my finger.
Okay.
And with the other eye, we'll do that. And just tell me when you see my finger.
Okay.
Perfect. I'm going to grab my pen light here and check his eyes if they're reactive to light. Perfect. Next I'll move on to his ears. I'm going to inspect his ears. I can use my pen light to inspect inside as well. Any pain in your ears? Okay. And I'm going to perform the whisper test. I know it's silly, but okay, he can hear my whisper test. So I'm now going to move on to the nose. I'm going to be inspecting his nares. I'm going to use my pen light for that as well. Okay, and we're going to have him perform a sniff test. Can you close your eyes and tell me what you smell here?
Beautiful incense.
Yes, very good. Sorry, just want to shut my pen light off. Okay, so now we're going to go to his throat. I'm looking at his throat here and his mouth. Can you open your mouth for me and stick out your tongue? Move your tongue up and down and side to side. Okay, I'm just inspecting his oral mucosa, noticing any irregularities. It all looks good there. Next, we are going to move to a cardiac assessment. So I'm going to have you lie down. All right, so starting my cardiac assessment, I am going to assess his neck for any jugular vein distension. I don't see any vein distension there. And next, I'm going to check all of his pulses. So I'll check his temporal pulses again. And his carotid, one at a time. His brachial. Radial. His femoral. The popliteal pulses. The tibial. And the dorsus pedis pulse. And all of his pulses feel very strong. So next I'm going to move on to auscultating his cardiac sounds. I'm going to start using the diaphragm of my stethoscope and listen to all 5 points of the cardiac. So we have aortic, pulmonic, tricuspid, mitral, and Erb's point. I'm listening for any arrhythmias, dysrhythmias, and any murmurs. I'm going to listen again using the bell of my stethoscope. Heart sounds good. I'm going to then auscultate his aortic artery. And his renal arteries. Lastly, for my cardiac assessment, I will assess his capillary refill. I'm just going to squeeze your fingers. Little pinch. I'm assessing for his capillary refill time. We want it to be less than 3 seconds. And check your other hand. And his toes as well for capillary refill. Okay, perfect. His capillary refill was less than 3 seconds. So next I'm going to be doing a respiratory assessment. If you could sit up for me. So starting the respiratory assessment, I'm going to be looking at his chest for expansion and symmetry as he breathes in and out. Okay, perfect. If you could turn your back towards me, I'm going to palpate his chest expansion. Can you breathe in and out? Perfect. It is symmetrical. And next I will start by auscultating his lung sounds. So I'm going to start on the back here. Just take a deep breath in and out and say 99 as you breathe out.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Okay, perfect. I'm going to also percuss when he's sitting his back towards me. So I'm just going to percuss your back sounds here. Noting the sound if it's dull or resonant. And his lung sound clear from the back, and his percussion is resonant. So if you can turn back around for me. I'm going to do the same in the front. Start by auscultating. And just say 99 for me again.
99. 99. 99. 99. 99. 99.
Perfect. And I will percuss again in the front. Perfect. And also for his respiratory assessment, I'll check his O2 saturation. So I'm going to put this on your finger. %. Wonderful.
Thank you.
Okay, so that was it for respiratory. I'm going to have you lie back down so I can do a GI. I'm going to lift your shirt up a little bit, that's okay. So I'm going to start by taking a general look at his abdomen, inspecting it for symmetry, any abnormalities, any visible masses. And then I'm going to auscultate. Okay, so I'm going to start in his right lower quadrant and work my way up. I'm listening for hyperactive, hypoactive, or normal active vowel sounds. And his vowel sounds do sound normal. Do you have any pain in your abdomen? And you know when your last vowel movement was?
Yesterday.
So after after auscultation, I'm going to lightly percuss in his abdomen. I want to do it in each of the 4 quadrants, at least 4 spots, and I'll move in a zigzag motion. Okay, next I'm going to lightly palpate his abdomen, just feeling for any pain and tenderness, any abnormalities. Any pain as I palpate?
No.
So for the sake of this video, I won't be doing a deep palpation, but that can be done to check for the size of the kidneys, the liver, and the spleen. We would do the deep palpation. Okay, so next I'm going to have you sit up again for me. And we're going to start a musculoskeletal assessment. So I'm going to start by assessing your range of motion in your neck. So if you can move your neck back for me and forward, and then side to side, try to touch your ears to your shoulder. Okay, perfect. Any pain when you do that?
No.
Okay. Next I'm going to be checking his shoulders. Can you shrug your shoulders for me? Perfect. And then checking his elbows. I want to check all the joints as well. Just going to quickly check the joints and his fingers for any swelling, any discoloration to the joints. Any problems with your joints? Okay. So for your elbows, we'll check the range of motion. If you can extend your arm. Yep. And then move your arms from the side. Okay. Perfect. And then your wrists, we're going to move your wrists up and down. Any pain when you do that?
Mm-hmm.
And then we're going to have you squeeze my hands. Okay. And we'll check the knees. While you are sitting, you're able to bend your knees. Can you push up with your knees to my hands? Okay. And we'll assess his ankles. The same thing, if you can bend them up and back down. And then I'm going to put some pressure there. Okay. Perfect. All right. I assessed his joints there. And next we're going to move on to a neuro assessment. So I'm going to check his reflexes. I don't have the actual tool, but we'll manage with this. So first I'll check his brachial reflex here. Checking if they're active. We'll check his popliteal reflexes. And his Achilles reflex. And all those were normal, we'll say, for the video. Next, I'm going to check some of his cranial nerves. So I'm going to have you raise your eyebrows. Okay. And smile big for me. And frown. Okay. And close your eyes real tight. Okay, perfect. And can you stick out your tongue and say, ah? Okay, perfect. Next, we're going to go to his sensory motor reflexes. So I'm going to have you put your heel to your shin and go up to your knee. Perfect, for both sides, yeah. And I'm checking to see if he does that in a straight line, which he did. So next we're going to do your finger to your nose. Very good. And we'll check your rapid hand movement. If you can place your hands on your knees and move them rapidly. Good job. Okay. And I'm going to have you stand up now and have you walk across the room. Okay, and walk back. And when you walk back, can you walk on your toes for me? Okay, and then walk on your heels. And I'm assessing if he's able to do that, assessing his gait. And then can you walk from heels to toes, heels to toes. Okay, you can sit back down. Now I'm going to test some of your sensory motor. So I'm going to have you close your eyes. And I'm going to run an object down your arm. I want you to tell me if it's sharp, dull, or soft.
Sharp. Sharp. Soft. Soft.
I'm going to do the same thing, but on your legs.
And sharp. Sharp. Soft. Soft.
Very good. Okay. Next, I'm going to place an object in your hand. We'll start with your left hand here. And I want you to be able to tell me what it is with your eyes closed. Yep.
Is it a paperclip?
Yep. That's good. And we'll try the other hand. And tell me what that object is.
Is it a coin?
Yes. Okay. So next, with your eyes still closed, if you can place your palms up. I'm going to write a letter in your hand if you can tell me what it is.
X.
Yep. And then I'm going to write a number in your other hand if you can tell me what it is.
8.
Yep, perfect. So next I'm going to have you stand up one more time here. And we're going to perform the Romberg test. So if you can cross your arms over your chest. And with your eyes open, I just want you to stand there. We're going to have him stand here for 30 seconds. I'm going to be assessing his gait, if he's swaying at all, any other movements. So first with his eyes open, and then I'll have you close your eyes now. And I'll be assessing the same thing for another 30 seconds with his eyes closed. So when that has happened, we'll be all set with the Romberg test. Very good, you can sit down. Next, I just want to do a little neurological exam on you. So, can you tell me your name again?
Joshua.
Okay, and do you know where you are?
Springfield. 9.
And what time it is?
About 6:30.
Okay, perfect. And can you tell me what you did for your last birthday?
I threw a little get together.
Okay. And then I want to assess your short-term memory. I'm going to say 4 words, and I want you to remember them.
Okay.
So the 4 words I want you to remember are cat, house, flower, book.
Okay.
Okay? So can you count back for me from 20 down?
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Do you remember those 4 words?
House, cat, book, plant.
Close it down.
Thanks.
Okay, so next I'm going to have you do another little number test. I want you to count down from 100.
Flower.
Yes. Count down from 100 by 7s. So you'll start at 100 and go down by 7s.
Okay. 100, 93, 86, 79, 72.
So yeah, we'll have him count down by 100 by 7s and see how well he does with that. Alright Joshua, we can stop doing that. I want to do another test for you. I want you to read this and do what it says. Very good. The test did say to take paper in left hand, fold it, and place it on the floor. All right, and that actually concludes our health assessment here today. Did you have any questions?
I did not.
Okay, very good. Thank you, and it was
All right.
nice meeting you.
Yes, thank you.